This segment sponsored by Plastic Surgery Innovations. Viewer discretion is advised. This segment may contain medical imagery before and after procedural photos that some viewers may find graphic or revealing.
Let's be honest, we've all heard the term BBL, which is a Brazilian butt lift. Okay, these butt implants and body contouring procedures are talked about all online and social media, but what actually goes into the procedure? Who's a candidate? And why do people get them? Well, we're going to break it all down with Dr. Joe from Plastic Surgery Innovations. Good morning, doctor.
Good morning.
Good to see you.
Welcome. I'm glad to be back.
Yes. Okay, so let's just answer the big question. What is a BBL?
A BBL stands for Brazilian butt lift.
Mm-hmm.
And it's a procedure used to enhance booties, used to enhance buttocks.
Mm-hmm.
It's a procedure combined with liposuction where fat is harvested from the rest of the body, typically the waist and the hips, the lower back, and then the fat is carefully processed, washed, decanted, and then transferred and re-injected into the buttocks. So that it's like blowing up a balloon.
Right.
You start with a smaller booty and you end up with a rounder booty.
A bigger booty. So with transferring the fat, though, one thing I'm curious about is fat is normally, liquidy soft. Why is it that some BBLs look a little stiff, a little hard, like a rock?
Part of it has to just do with the turgor of the tissues, how tight things get. It's like blowing up a balloon.
Mm-hmm.
When you first have a balloon, it's real soft and flimsy, and you put a little bit of air in it, it's soft and flimsy. But when you put a lot of air in it, then it becomes full.
Okay.
We call it a Brazilian butt lift, but it doesn't really lift the tissues like we have other procedures that do. It makes it, fills it out, and it enlarges. And a lot of people want that look. I had a young lady tell me, she said, Dr. Joe, I don't want bigger breasts. I want a nice booty. And so it's become a more and more popular procedure.
It is popular. Okay, but is the procedure dangerous? What are the risks?
The risk of doing a fat transfer is that you can die from an operation. But when you look at it years ago, when we were first doing tummy tucks, tummy tucks had a mortality risk too. And everything that we do in surgery has a risk. Brazilian butt lift got a bad reputation because there were a number of deaths that occurred in Florida over a short period of time, most of them on one street of plastic surgeons. Most of them associated procedures done at the end of the week. So it was thought that maybe that was due to surgeon error. It was thought at one time that the risk of dying from Brazilian butt lift was 1 in 3,000. And there was a big article in one of the newspapers calling it one of the most dangerous operations in America. That's changed as we've defined the technique. It becomes dangerous if the fat's injected in the wrong place. But techniques have advanced. And so now the actual risk, most recently reported, is about 1 out of 26,000. And even that risk can be reduced if certain rules are followed.
And then, so you say it's risky if it's injected the wrong way. If it's injected, does it just make deformity? Does it travel to areas it shouldn't? Or is there like a life risk with it?
The risk and why it became a procedure that lost credibility for a short time is because if the vein in the muscle of the buttock gets injured and the fat is injected into that area, the vein will pick up the fat and it'll travel to the heart and or lungs and create what's called a fat emboli, which can be fatal.
Interesting.
There were 25 deaths reported over the past several years. But that incidence has gone down significantly over the past 10.
So is there a difference between a Brazilian butt lift and butt implants?
There is.
Okay.
A Brazilian butt lift is ideal for somebody who simply wants volume because A Brazilian butt lift takes a butt that's smaller and blows it up like a balloon.
Okay.
One of the hard things about that is I always explain to people that if you come in and you have a Mickey Mouse balloon and we blow it up, it's going to look like Mickey Mouse.
Okay.
It's not going to look like Donald Duck. You can't make a Mickey Mouse butt look like a Donald Duck butt.
Okay.
Because it's simply volumizing. The nice thing about butt implants is they don't have some of those same limitations. We tend to use implants more in people that are very thin and maybe don't have a lot of fat to harvest for a butt augmentation with fat.
Right.
The implants are a whole different technique. They're a lot more expensive. They're a lot more recovery. But they also don't change volume when you add or lose weight, where a Brazilian butt lift can.
Okay, so with these procedures, are these one-offs? So if someone gets the lift with the transfer of fat, or if they get the implant surgically added to their buttocks, is that it, or do you have to come back for fillers to get it redone?
With the implants, typically it's one and done. With butt augmentation, the problem is that everybody loves it immediately after surgery because you're swollen and you've got that nice shape, and they put their jeans on and they look in their mirror and they go, I look good. But not everybody keeps all the fat. So sometimes people will love their results at 7 months, but come back at 2 or 3 years going, I need more.
Interesting. So is there, because I'm assuming, I'm trying to think about the process of when we lose fat from working out. So if they're trying to stay in shape, are they losing that fat that you've added?
It's not so much that they're losing the fat because they're staying in shape. It's simply that fat cells that we transfer, not 100% of them live. It's kind of like planting grass.
Yeah.
You know, you till the soil and you plant the grass and you cover it with straw and you water it. But it doesn't mean that you have this beautiful, complete lawn. Sometimes you have to redo this area or that area. It's the same with fat transfers. A number of patients will come back because they want more and do a second procedure, which of course costs money and time.
Is there ever a time that it's too much, like people should stop?
It can be. You know, the number of Brazilian butt lifts we did rose by 600% after Kim Kardashian hit the cover of a magazine. And everybody wanted that. And the problem is not everybody can achieve that because the skin envelope doesn't accommodate it, especially if patients are heavy. It's not also the right operation for a number of patients, especially if they've aged or have weight loss. The problem is if you have a firm skin envelope, it works really well. But what if you have a relaxed skin envelope? You add fat to that, and the fat may not sit and look the way that you want. So we also consider skin procedures, actual true butt lift procedures, like a Miami thong lift, for people that want bigger improvements, but have skin laxity as part of their issue.
Interesting. Miami thong lift. What a name.
Miami thong lift.
So lastly, though, I'll ask you, because I can think of several celebrities that have gone too far. When you work with people locally, what's the reason? What's the real reason that they're coming in? Why do people really want this procedure done?
For a lot of people, they just want to get that youthful appearance back again. You know, they want those curves. And for us, doing it in combination with liposuction, what I explain to people is if you think of a side profile of the back and the buttock being even, one way you can get a nicer profile is by adding to the butt. But the other way that you can get a nicer profile is by removing fat from the lower back. So if you do those simultaneously, the back goes in, the buttock comes out, and it gives people that nice shape that looks great in a skirt or a nice pair of slacks, or even a pair of jeans. You know,
that little dip, that little back dip.
For a lot of people, they just want to look good. They want to feel good.
Well, interesting. This has been so good. Thank you so much, Dr. Joe, for breaking it down and giving us an inside look into plastics.
You're welcome.
And if you would like more information about plastic surgery innovations, we'll have their website listed below. They do offer consults, so you can have this conversation and learn what's best for you and your body. And I'll see you after the break.
This segment sponsored by Plastic Surgery Innovations.